My name is Naveen Jakhar. I'm a civil servant of Indian Telecom Service 2014 batch and presently posted as ADG Security in DOT Haryana LSA, which is a field unit of Department of Telecom. To share with the presentation, I'll be sharing our innovative project which we undertook during the COVID-19 pandemic, and the name of the project is COVID-19 Quarantine Alert System. The system, which was designed in the first wave of the pandemic as a tech-enabled system to monitor and enforce the quarantine of the mild cases at home, moved to a different scale altogether with respect to the tracking of the migrants who were moving here and there.
Faizan, what is the serial number? Sorry, sir. Faizan, what is the serial number of this?
Yeah, please.
And during the second wave of COVID pandemic, due to the outbreak of the Delta variant, we provided a backbone to the real-time oxygen tracking system in this country. So let's try to have a look at the innovative system that we have designed. So CQAS basically is serving three different purposes. The system was designed on 29th of March 2020 in the first wave of COVID pandemic, and it was primarily designed to handle whether the mild cases of the COVID who were advised to stay in quarantine or isolation at home, whether they were following to the norms or not. Till date, it has been utilized by 18 state governments and UT governments, and it has handled 36 lakh quarantine targets, and we have generated more than 21 crore quarantine breach alerts to the designated state government authorities. And along with this, the second issue that we handled was tracking of the migrants. During the first wave of COVID-19 pandemic, we tracked approximately 65 lakh migrants who were moving from one place to another. They belonged to Haryana, Madhya Pradesh, Bihar, and Odisha. And this part was operational from April 2020 to July 2020. Then, due to the outbreak of Delta variant during the second wave, there was no nationalized and centralized system for tracking of real-time, transportation of oxygen. So in that case also, the CQAS system came in handy, and we have till date the system is operational, and we have tracked more than 38,000 oxygen-carrying trucks, and we have tracked approximately 5 lakh metric tons oxygen, which is being supplied to the different parts of the country. So as we know that COVID-19 pandemic, the first case was recorded in the December 2019, and within the span of 3 months, it spread to 151 countries, and it forced the WHO to term it as a pandemic. The 4 T's that we understood, as far as technology is concerned, that testing, tracing, tracking, and treating. These are the 4 T's, which have acted as the pillars to tackle the fight against the COVID-19 pandemic.
You are in. We can see only your first slide.
Sir, just a second, sir.
Okay, now I can see your fourth slide.
Now you can see, sir.
Yes.
Okay. Just a second, sir. Okay. Now is it visible in full screen mode, sir?
No.
Okay, ma'am. Just a second. Just give me a second.
No issue. You can run like this. You have to simply move your slides.
Right, sir. That I'll do, sir. So in India also, when this approach of keeping the mild cases, in quarantine at home due to the limited healthcare infrastructure, different state governments, the district administration and the municipal corporation, they started to have GPS-based app solutions. Some tried to came up with the wristband solutions. But considering the population size of India, the wristband solutions were proven to be too costly. And with the GPS-based apps, there are basic 3 limitations. As on March 2020, approximately 55 crore Indian telecom subscribers were still using feature phones. So they could not be, encompassed in the ambit of these kind of app-based solutions. And these app-based solutions are highly dependent on the end user who is, already suffering from the COVID pandemic, and they were basically requested to keep on uploading their photographs. They were told to keep the location on. So it makes, the system very heavily dependent on the end user. Also, the poor section of the society and the old age people who were most vulnerable to COVID-19 pandemic, they mostly use the feature phones. So, they would have been left outside of the scope of the GPS-based solutions. And the major issue was there was no centralized quarantine monitoring system available at the central government level. So, just a second. So, a team of young Indian telecom service officers, we tried to design something innovative, which could handle the number of the cases, and which could handle both the categories of the smartphones as well as feature phones. So we basically exploited the location-based services of the telecom network. Using the LBS, we can extract the location of any mobile device at any given point of time. In this, there is no need of requirement of any GPS to be provided in the mobile device. There is no need to install any application in the device. So what we are doing, basically, we are fetching the first time, we are fetching the location of a target during the first night, so that we can fetch 6 or 7 locations. Then we can zero in down that this is the home location or the quarantine location where the patient is supposed to stay during the period of the quarantine. Now, every 15 to 55 minutes, the system is programmable. We basically take out the real-time location of the target, and then we try to compare using the geofence whether the person is at the same location or he's moving away. So this is the basic concept using which we try to generate alerts for the persons who are breaching the quarantine to the designated authorities of the state governments. So basically, CQAS is divided into 4 basic modules. The first module, because we wanted to have a very simple architecture at the state government, the approval comes from the from the state government Home Secretary under the provisions of the Indian Telegraph Act 8085 and the Epidemic Act 1897. The numbers are shared with us as the nodal team. Then we basically filter out the mobile numbers on the basis of different operators, and we generate the file. We send the file to the operators, and we start on fetching the location through a periodic automated manner. And then we keep on comparing the locations. And as soon as we detect a geofence breach, we generate an automated SMS and email alert to the state government. But we understood the requirement of the state government that along with the emails, they wanted us to directly plot the geofence breach on the state data centers and their dashboards. So the team went a mile ahead, and we even hand-holded their state teams, and we started plotting the quarantine breach on their systems also. So far, the system has been utilized by 18 states. It has served more than 475 districts of India. And at a given point of time in the month of May and June 2021, there were 6 lakh targets which were simultaneously provisioned in the LBS network. This kind of scale has never been handled in any of the telecom network anywhere in the world. And the system has been utilized, designed utilizing big data analytics and the location-based services of the telecom network. There is a dedicated GIS mapping enabled. The data is being plotted on the National Disaster Management Authority, to the State Disaster Management Authority, and to even the district administration dashboards. So this is how the system works. Basically, we get the numbers which are to be provisioned in the system from the state governments, and then we filter out the number based on the operator, and then we basically start on extracting the information from the telecom network. There is no user dependency, and then we keep on analyzing whether the person is breaching the geofence or not, and then accordingly we basically provide secure feed to the state data center. Automated email alerts are generated, and then a dedicated feed goes to the NDMA portal also. So this is how the breach chart looks like. This is the National Disaster Management Authority COVID-19 dashboard on which the real-time breach were plotted. And this is how the movement chart looks like. We were even able to pinpoint the person who had just breached the geofence. And as soon as he breached the geofence, the subdivision officer was alerted, and they got hold of the person. This is how the data is being shared. This Google Live location is being shared with the authorities so that they can easily handle that person. And basically, this is the broader diagram. We generate real-time breach of the alerts. Distance, movement, segregation is available. Different kind of layers are available, and repeated offender segregation is also calculated, because the telecom network is totally dependent on the environmental features. So specialized statistical correlations were developed so that we could provide 99.9% accuracy in every information that we were generating. Then the second aspect is the tracking of the migrants. So the migrants moving from the big towns to their villages, and sometimes they were using their devices, and sometimes they were not using their devices due to the limited resources. So we started to track every person which was being required by the state government. So we created a very huge matrix consisting 36 states and UTs. So we generated a matrix of 36 cross 36, and we provided filtered information to the state government. And then on the basis of those numbers, we again provided their real-time location to the state government, so they could help the migrants with respect to the shelter, with respect to the medication or treatment, or with respect to the food, whatever they could offer. So using this part, we tracked almost 65 lakh migrants in real time. The next point is related to the real-time transportation of the oxygen. As we know, in the second wave, due to the outbreak of this Delta variant, the SpO2 level of the patients, it went down, and we had a very high mortality rate. So the need of the medical oxygen supply, it rose drastically and exponentially. But at that point of time in India, there was no centralized platform or system available to track the real-time transportation of the oxygen. There were two basic issues. Either the truck carriers were not fitted with the GPS, or even if they were fitted with GPS, there was no a standard API through which we could have extracted the data and we could have handled, or a dashboard on which the real-time transportation could have been visible. So basically, we tried to create a different module in the CQAS, and we handled this particular issue with the help of the MHA Home Secretary of India. And then with the approval of the Home Secretary, what we did, as soon as the truck driver and the helper, they reached to the oxygen plant, at that point of time, we started fetching their location. And every 15 minutes, we kept on fetching their location until the trip was completed. And this project is a joint effort of Department of Telecom, MIT, Ministry of Road Transport, Highway, and NDMA. And till date, using this system, we have handled more than 38,000 oxygen truck carriers. And during the peak of May 2021, we handled approximately 400 oxygen trucks per day, and the real-time information was disseminated to the state government authorities so that they could plan in advance to which hospital they wanted to supply the oxygen, and what should be the proportion in which the oxygen supply is to be handled at different hospital levels. So this is how the system looks like. We get the number to be enabled in the CQAS system from the MIT server, and then we provision the targets in the system. Every 15 minutes, we keep on fetching their location, and the real-time location is being drawn on a dashboard which has been plotted by MIT, and the information is shared with the state government authorities for taking necessary action at their end. So overall, what CQAS is? CQAS is a 24/7 alert system for detecting any breach in the geofence. We were able to handle even the switched off and the unreachable mobile phone targets, completely indigenous system, and it has been designed with a zero cost. No cost has been incurred. We utilized a spare server which was present with us, and complete conceptualization, designing, implementation, everything has been done by a team of 3 or 4 officers. The system is completely secure, robust, and scalable. It has a legal sanctity under the provisions of the Indian Telegraph Act and the Epidemic Act. It supports both the feature phones as well as smartphones. So I'll share.
Sorry for interruption, sir. Can you please conclude your presentation in 2 to 3 minutes?
In just a minute. So what are the challenges? Basically, the LBS, the location-based system, the services of the telecom network have never been tested to such a scale that 6 lakh parallel targets have been provisioned in the system. And the real-time system, it has never been designed using the location-based system of the telecom network. So using our 24/7 efforts, we were able to handle both the requirements. And let us, So I'll speak briefly about the innovations. We were able to handle 6 lakh parallel targets. We were able to provide the real-time breach statistics to the state governments, and the system is capable of handling 99% accurately. We are able to pinpoint the location of the targets with an accuracy of 30 to 40 meters. We are able, the data privacy, that is the main concern. It has been designed at the core of the system. On the last day of the quarantine period, the number and all the information, metadata, is automatically deleted from the system, and there is no traces available in the system. So what is the impact of the CQAS? It has been offered to all the state governments free of cost and on 24/7 basis. It is operational since last 2 years. Basically, as you know, the state administration or the district administration, they were putting key personnel for manual monitoring of the patients, but this system has reduced their requirement by 80 times. That means we have drastically helped the frontline workers of the country, thereby saving their lives also. This is it from my side. And the CQAS, you know, which started as an idea, it has reached to the United Nations, and I'm glad to share that it has been added to the ICT repository of United Nations 2021 report. And this is the futuristic vision of our team, that what we want to do, how we can, you know, basically standardize it as a universal system for tracking the people who are caught in some kind of cyclones, floods, or maybe who are going to some kind of pilgrims, that real-time information can be provided to their near and dear ones, so that, you know, we can effectively utilize the telecom network with a human touch. This is our vision. So these are the team members. Thank you so much for the time, ma'am.
I think great work done. Quite innovatively, you used the existing system. I must say that.
Thank you so much.
I have only two questions.
Ji,
Regarding the first one, the oxygen tanker and all that, that is something probably all right. Most of the bus tracking system and all that, the similar features have been used. So that is okay. I'm not. I'm more concerned about the quarantine system. It was very important at that point of time. Arogya Setu also has a similar facility. How this is different from Arogya Setu?
Arogya Setu basically utilizes the Bluetooth part and the GPS part. So Arogya Setu system utilizes those two aspects, and Arogya Setu works only on the smartphones. So on the parallel lines of
Arogya, okay. So this is that you are relinquishing the need for a smartphone because you don't need to download this app.
We don't need the GPS location. We don't need the app. And ma'am, the
that I understand.
No, the feed of this system was even given to the SSS platform of Arogya Setu also.
So the next question is, what is the accuracy? Because everything depends on the location of the person, identifying the location. So that doesn't breach the quarantine borderline. Okay. So what is the accuracy of your data?
Yes, ma'am. So for BSNL and Vodafone Idea, because they are having the triangulation methods, we were able to detect a person with the accuracy of 150 meters. And for Reliance Jio and Airtel operators, because they have implemented the assisted GPS technology, we were able to pin down the person even with 10 meters of accuracy, ma'am. In some times we were able to even defeat the
that is you know, accurate enough. Very good.
Thank you so much, ma'am.
So, sir, the assumption is that everybody is having a mobile phone.
Sir, actually, we are 135 crore Indian citizens, and we are having 120 crore SIMs also. So even if a family member, you know, gets infected, the near and dear ones or the first contacts, they were supposed to be, you know, residing in the homes. If anyone goes outside keeping the device with him or her, or even someone tries to, you know, basically takes the phone to the airplane mode or switches off the phone. So we should have been able to detect those kind of scenarios also, sir.
Okay, good. Technology should be used to its fullest level, and you are trying to do that. Really good project. Thank you very much.
Thank you so much, sir. Thank you, ma'am.